Okay, so picking back up, there are multiple ways for individuals to use heroin and opiates in pill form, injection, smoking it, snorting it, and then, of course, depending upon how that is uh, used, the severity and intensity and the sort of quickness of their high, it depends on that. And one may start with just taking opiate pills, and then move on to quicker, cheaper, and more intense IV use. And certainly with IV use comes other ancillary problems like that occur with needle sharing, hepatitis, just the spread of infectious diseases, and then abscesses, infection, skin infections, and there's a pretty gruesome picture from someone who was using crocodile in your book, but just by not using that substance, but using heroin, can also cause some pretty significant skin issues. Oftentimes, when folks shoot up heroin, or again, what they think is heroin, they don't know what it's mixed with, and it can be mixed with meat tenderizer and some other sort of really gnarly, nasty substances, and those have negative effects on skin cells. Meat tenderizer, obviously, what it does to your chicken or your steak. Imagine what it could do to your muscles and your fat cells and skin, and just imagine the sort of pain and discomfort and hospitalizations that would need to occur. Of course, when you're using and you're that far into your use, going to the hospital for things like skin infections as a result of using may not be your first priority. Okay, moving on. Let's see. There's some interesting information about placental barrier and blood-brain barrier. Very, very, very easy to cross the placental barrier, and as a result, it is, we are experiencing as a country a vast, vast, vast number of babies addicted to heroin, and of course they are given, they go through withdrawals, and so they are given. Unfortunately, these poor little munchkins are given, having to be given opiates and weaned off of opiates, upon birth, and so that's a pretty traumatic way to sort of start your life. Then social services, of course, gets involved, and it's, hopefully, again, it's another opportunity for the individual to request and seek treatment. Okay, let's see here. You can see here at the very bottom of this PowerPoint where morphine relieves anxiety, aggressiveness, and feelings of inadequacy. And so this just sort of speaks to what I started off with by numbing or relieving that emotional or psychological pain. You can see how this substance is very beneficial at alleviating and relieving this type of discomfort. And so it makes a great deal of sense why someone would want to feel this way and would want to feel this way all the time. The opposite, of course, is terrible. If you constantly felt anxious, if you constantly felt depressed, if you constantly felt, had to deal with trauma and you didn't know how to deal with trauma in an effective way, this is a much better alternative. It's not healthy. So don't confuse that with being a healthy alternative. It's just an alternative. And as human beings, we don't always choose sort of the best way of coping. And this is certainly an example of not a very good way of coping. So here you can see adverse effects: dysphoria, restlessness, anxiousness, nausea, and vomiting. So just the use itself can cause some pretty upsetting things to happen emotionally, psychologically, and then physically. And one of those is certainly anxiety on the emotional side, or restlessness, and then on the physical side, nausea and vomiting. I don't know if any of you have ever heard of anyone who gets really sick when they use opiates, or they have had opiates. But it's not uncommon for people to throw up or feel nauseous and or throw up as a result of using opiates. And it's not uncommon for individuals who are addicted to opiates to throw up and continue to use because the high is so great. But that's something to know. Again, this goes into everything is sort of shutting down or depressed when you use, and that's why it's such a great pain reliever. That's why it's great for surgery and great for when individuals have injury. Individuals who are struggling with or suffering from terminal illnesses, cancer, and their, HIV, AIDS, sort of at the end of life stages where there's just constant pain. Morphine is great for allowing them to sort of live out the rest of their days pain-free. This type of medicine is not necessarily appropriate if you break your arm. So we can see this. Someone who's dying of cancer and is in constant pain may need constant pain relief. Somebody who broke their arm does not necessarily need long-lasting, long-acting pain relief that has so many negative side effects. And here is the crux of the problem. We had pharmaceutical companies and doctors prescribing these really, really, really heavy meds for really minor injuries, or maybe even major injuries that had sort of quicker recovery time. I had this interesting conversation with an anesthesiologist once, and she was from Nigeria, and she had this very interesting way of putting it into perspective because we were talking about the idea that doctors, and certainly we do too as counselors if it comes across us, but doctors have the responsibility of telling their patients, hey, you just had major surgery, you're going to be in some pain, and expect that, as opposed to, hey, you just had major surgery and here's a bunch of medicine so you never have pain. Well, that's unreasonable and unrealistic. And, as medical professionals, they should be and are, I think, the tides are sort of turning here, but doing a better job of saying, hey, look, you just had major surgery, you're going to be in pain. And the expectation of you not being in pain or me giving you medicine to alleviate that kind of pain is just not going to happen. And so setting the expectation up for there to be some pain versus setting the expectation up of never having any pain. And that can certainly help curve the want or need the individual has to not have any pain at all, thus reducing potential tolerance and addiction issues and dependence issues. And the doctor, the anesthesiologist that I had a conversation with, she said, if you use the hammer to kill the ant, what will you use on the elephant? Now, I'm not really for killing any sort of animals, but as a metaphor or an analogy, I thought that was kind of interesting. And so it kind of puts it in perspective, that as human beings, it's unreasonable for us to think that we won't have any sort of physical or psychological pain. All right, let me keep going here. You can see all the various ways that it affects our person. Huge major effects on GI tract, slows everything down. That's why constipation is such a big side effect. I mean, it's a big side effect. It's a really big side effect of these types of meds. Let's see, the withdrawal is obviously sort of the opposite of the intended effect. And so in opiates, withdrawal would be hyperexcitability of all of those systems and organs that were suppressed when you were using. So GI tract goes crazy, which is why folks during withdrawal have really uncontrollable bowel movements, lots of diarrhea, lots of throwing up, lots of shaking and heavy breathing, lots of sweating, body temperature goes up, body temperature goes down. It's pretty again, sort of just think about hyperexcitability in all of those systems. Let's see, this goes into sections of like different types of pain, and I think this is pretty interesting. this is really important for us, these risk factors for opioid misuse. And so if you look at these criteria, if you look at these factors, you can see that, these are pretty common risk factors that we're going to see in our work. And as a matter of fact, I would argue that these are common risk factors in a lot of people, a lot of human beings, period. So, I don't think that this is an exclusionary substance. This affects everybody and affects everybody across races and socioeconomic status and genders and cultures and the like. Let's see, this goes into some gene tolerance and withdrawal. Tolerance and withdrawal are the sort of obviously going to be present. There's in opiate use, and just the avoiding withdrawal can certainly be a huge avoiding the opiate withdrawal can be a huge factor and reinforcer in wanting to continue to use or needing to continue to use. Let's see. So cross tolerance, using one type of opiate and then developing a not as strong a response to another opiate, another medicine in the opiate family. So we know that, even though you may have never used it before, as the example shows here. And then, of course, there's certainly the physical dependence and abstinence syndrome here. Make sure you read up on that. Here are this is a really important chart for you to have. Here's the withdrawal symptoms. Let me see. I want to jump through here. Last couple of minutes here. Oxy, this talks a little bit about Oxy and how it's easy to obtain, and this is sort of the pill form of it, but you can crush it. And they've done a couple different things with different pills, like coating it in gel or making it so that way if you crush it, it dissolves and you can't use it. But individuals always find a way. And then certainly you can just move on to heroin. This is talking about fentanyl and carfentanil, so 50 to 100 times more potent. So here you go. So fentanyl's, okay, good. I did have my memory did serve me correct. 50 times more potent than heroin and 100 times more potent than morphine. So you can imagine that expecting to take the same dose of heroin when it was, say, maybe just sort of stepped on or crushed heroin, and not knowing that it's fentanyl, that could obviously lead to a pretty significant overdose rates. And we are seeing that certainly now. This is just a representation. So this is how much heroin, this much heroin produces this effect, and it would only take that much amount of fentanyl to produce the same amount. So it's pretty strong. And it's all over the United States. This is this part here. I think it's important for you to pay attention to the environmental cues that can result in tolerance. And so what that means is that just by virtue of being in the same geographic location or the same area, that you can start to feel the effects of a substance. Just being en route to, let's say, your drug dealer's house, you can start to feel the effects, maybe even the physical effects of it. But we find that these environmental cues certainly do play a role in influencing continued use. Drug injection rituals, you will find this all the time, where there's a ritual and there's a way of going about using that an individual will have that can elicit the same sort of relief that comes with using that substance. It's quite fascinating how our brain and memory and psyche sort of work. Let's see. I'm going to go on here because we're sort of wrapping up here. Methadone and buprenorphine, pay attention to those sections. We're going to talk more about that when we talk about medicated assisted treatment, but read up on that and know that is what is proving to be quite effective, particularly buprenorphine in the sort of Suboxone and Subutex. And then, of course, there's a small section